Thank you, Phil. Thank you for the opportunity to introduce myself to you today and tell you about an aspect of NICE work that's really important to us. So who am I? My name is Alexia Tonnel, and I am a new director at NICE, responsible, amongst other things, for ensuring that NICE is fit for the digital age. So why is this work so important to us? Well, we've sort of heard about it all through the conference already. It's technological advances out there are changing our world. They're changing our work, the way we interact with information, and the expectations we have of information as well. So it's really important for NICE to embrace these changes and to transform with it in order really to fulfill its mission. And the good news is that we think we are doing that at NICE. We are transforming with these changes. And technological developments have already transformed the way we communicate with our users. Again, you've seen that throughout the conference today on a number of occasions. We are making it much easier, much more convenient, much more practical for users, for health and social care professionals, for patients to find what they need from us. So over the next 20 minutes, what I'll do is take you through the work that our teams have done at NICE to improve and to continue to take advantage of these changes over the last 12 months. A tile wall has appeared behind me that sort of summarizes the area we'll now explore. We'll be looking at the NICE pathways. I'll tell you a bit more about those pathways. We'll look at the new NICE website and some of its core features. I'll be telling you about what we've done with the guidance app and also new features that we've introduced to NHS Evidence. And finally, we'll have a sneak preview of the work we're doing around the NICE BNF app. So starting with pathways. Pathways are one of the most important developments for NICE over the last 12 months. A short movie will start behind me that will remind you of the features of pathways. They are effectively a way of presenting in a very intuitive way and much more interactive way everything that NICE has said on a particular topic. When we launched Pathways last year at the conference, if you remember, we had 7 pathways live on the website. There are now more than 60 of them available on the NICE website that can be visited by everyone. And what's next with Pathways, where there are more than 50 in the pipeline, with the intention to cover our back catalogue of guidance through this format, as well as issue pathways alongside new guidance that comes out. And over time, we want to really incentivize users to enter guidance and to find the information from us, all the various products that NICE produces through Pathways. In the last year, we've also introduced a new function of Pathways, which is to allow for our users to print them, which has been very well received. The other thing that we've been doing with Pathways last year is to introduce a new functionality related to public health. And that's what you have behind me there, the Effective Interventions Library. This is a new way of presenting information about effective interventions that have been recommended as part of our public health guidance. The content itself is not new. It was always there, available. Our committees always review evidence about interventions and assess it. But what is new is the way it's presented in a very easy, accessible way on the pathways, as opposed to being sort of probably available somewhere deep in an appendix of an evidence review. So how does it work? Well, you can see a pathway here. We've piloted this approach now for 2 pathways, alcohol and smoking. What you have at the top of the pathway is a new tab that has been introduced called the Effective Interventions Library tab. And then if you click on that tab, a menu of generic interventions is made available to you that will give you on the reading pane on the right a list of specific interventions related to that category. So for example, what information does it give us? If you click on the brief advice for physician, this is what appears. So in a short format, easily accessible straight from the pathway, you can see information about this intervention. The what is it, exactly the details of the intervention, how it works, with whom it works, how it's, and where it has been used. There is information we've been asked as part of those short summaries to provide references and links to publications where possible. We've developed this product with the contribution from our users and the community in public health. And what they've asked us to put, to make much more easily accessible to them is, for example, information about the relative strength and impact of each intervention. For example, the effect size, number needed to treat, or whether the particular intervention has an impact on health inequality. We've also been asked where that information is available to provide information about the cost or the return on investment of that intervention. So really allowing, through this library of intervention, rapid access to important information about how to put in practice our guidance. An important element I'd like to highlight is that this evidence about intervention doesn't necessarily stand on its own, and it's really important that it's read in connection with the rest of the guidance, and that's why, and with the recommendations that led to that intervention, and that's why we've embedded this information within the pathways. So over time, we'll be bringing this feature to all our public health pathways, building a quite substantial library of effective interventions. I'd now like to talk to you about the NICE website. The NICE website remains one of the key interfaces between users, our audience there, and NICE and its products and services. It is visited more than 500,000 times a month, approximately, and we understand from recent user research we've done that after Google, it is the second most used website by professionals looking for evidence-based information. So we know it's very much used there. We also knew that our website was getting quite tired and hadn't necessarily moved on with the changes and some of the new services that had been taken on by NICE. So earlier this year, we launched we effectively relaunched our website, and we transformed it quite radically with very good feedback received so far. I would invite you to tour the website for yourself, but I'd like to show you particularly 3 areas that I think are worthy of a highlight. First of all, we've made the website much more welcoming to our users. We've introduced this billboard sort of area there that allows us to provide and to feature some key messages. For example, we're all here today, so we must have done something good there. And then obviously as well some promotion about some key products of NICE and key services, for example, the NICE quality standards we've heard about. An important feature of the NICE website as well is that we've made it much easier to navigate the breadth of services that NICE provides today. And this behind me is an example of a new landing page we've introduced for the new NICE Medicines and Prescribing Center, which some of you will have heard about at one of the stream sessions yesterday. So what this shows you here is the various types of products of the Medicines Prescribing Center, where those will be made available over time. And this page is available straight from the homepage of the website. Finally, regarding the new NICE website, another element I wanted to highlight to you is the new Find Guidance feature, which really exemplifies how the changes we're making to the way we communicate with users is all about making it really easier, much more convenient for them to find the information they need from us. And here, obviously, guidelines and guidance. So what is this? Well, from anywhere on the website, you will find this menu, this Find Guidance menu. This, by the way, is called, I'm being told by our designers, a mega menu. So if you click on the mega menu, what you get is you access a much improved search and browse functions for our guidance. So I don't know if you've tried it for yourself, but we've categorized the guidance against lots of different dimensions, which makes it much easier for our users to hone on to the guidance that they really want to find. And the best thing is that once you've actually identified the guidance you want, we've made it much easier for you to navigate this guidance and find the information much more quickly that you need. This is there's no need anymore to trawl through a long PDF. We call this our sort of web viewer internally, and it's really about making it much easier to navigate the piece of guideline. So on the right here, you have a table of content, and by using this, you can go straight to the section of the guideline you want using your web browser. If you must, you can still download the PDF, which is available here, print it and read it at your leisure. So I'd like to tell you a bit more now about what we've been doing for mobile devices. Earlier this year, we launched the first app from NICE for Apple, for iPhones and Androids, and that's the NICE Guidance app, which many of you will have seen and heard about already since the beginning of this conference. This has been extremely well received, and again, it is about making it so much easier for everyone to get access to the guidance that NICE has produced. I heard people yesterday in the hall talking about the NICE guidance and how great it is that you can find all this guidance at your fingertips on your smartphone. No need for Wi-Fi. Once you have downloaded it, obviously, it's available to anyone. Our 760 pieces of guidance or so are available on that app. So, I thought I'd give you a quick demo of how it works. By the way, it's been downloaded already 35,000 times, and it's on the top of the Apple chart on the Apple Store. So let's say you have a patient who has presented in an emergency ward with a distressed atrial fibrillation. So what are you looking for? You're clicking on the condition, the cardiovascular disease area, arrhythmia. You can find atrial fibrillation conveniently at the top there. And then very quickly, through the guidance, you can find the treatment for paroxysmal AF. So it's very fast. This is almost real time, I think. You can bookmark the area of the guidance you're interested in and come back to it later. You can also share chapters of the guidance with a colleague. So we've heard how much people have liked this, and we heard also today that people want more of these. And so I think we've heard that, and we'll take that into the program of work that we need to do going forward. The next item I'd like to discuss with you is NHS evidence. NHS evidence is effectively, and here's the homepage for it, a vast evidence searching service for NICE that gives you access to a vast array of resources, of journals and bibliographic databases and reference documents, all from one place and free of charge. What I'd like to discuss with you today regarding NHS evidence is three particular areas. First of all, I'd like to remind you about the medicines topic page feature of NHS evidence. Secondly, I'd like to show you how we've applied this approach to building topic pages around particular topics to develop some new feature around public health. Finally, I'd like to tell you a little bit more about improvements we have made to allow users of our journals and database service to search for evidence much more effectively. So starting with the medicines A to Z and the medicines topic pages, I think these were mentioned again yesterday by Jill in one of her sessions. We have effectively developed a new way of presenting lots of different types and sources of information in one easy to navigate format. And we've done that for all medicines, really, that one can think of. So I think this is the beginning of the A to Z of medicine topics, and there's about between 2,500 of them, I believe. So if you choose one of those medicines, and here that would be ibuprofen, what you see is effectively a series of panels that provide you with different types of information from different sources. The most important page, probably panel, is in front of you, and that's a prescribing one that gives you access to the BNF monograph for this drug. So you can access and navigate the entire series of BNF references and monographs and information through NHS evidence. The next panel is the summary of product characteristics from the EMC. There is also a panel from the EMC again of the patient information leaflets. There are also panels for guidance related to this particular drug, here ibuprofen, or news, also a panel for news related to this particular drug. So all of this available on NHS evidence for more than 2,000 drugs. Now, this feature of NHS evidence has been very successful. Again, we understand from our research that pharmacists are actually one of the group of professionals that are most aware and the highest users of NHS evidence. 70% of them are aware, and more than 50% of pharmacists use NHS evidence on a regular basis. And we believe that one of the reasons for that is this really sort of successful feature on NHS evidence. So what we've done is that we've taken this approach and this presentation of evidence using this sort of this gathering of various sources and types of information into an easy navigable format. We've taken that approach. We've applied it in the past already to clinical topics. We've now taken it into the public health world and developed some public health topic pages, we call them. We've done that in collaboration with the public health communities and stakeholders, engaging through a number of workshops, etc. The panels are different for those topics because it's a different audience. We're looking at guidance information, looking at implementation tools, looking at case studies and information for the public. We started with 11 topic pages for public health, for example, physical activity, tobacco control, diabetes prevention. There's an example in the next slide of what we've been doing with regard to the workplace health, for example. There's a topic page on that. And what you can see here is the guidance panel, which has guidance from NICE. On those guidance panels, you typically also see guidance information from the DH or guidance from the UK's screening centre, National Screening Centre, for example. I would now like to talk to you about our journals and database service on NHS evidence. Not everybody might know, but this is one of the highest used surveys on NHS evidence. There are depending on the month, between 1.5 and 3 million searches done on this particular site and service of NHS evidence. It provides free access behind an authentication called Athens, which is available to everyone working in or for the NHS, gives you access to a vast array of journals and bibliographic databases. So, for example, the Lancet is now available, as many of you will know, through this service. So what we've been doing in the last few months is we've refreshed the way our users can search this sort of multitude of sources much more effectively. There is an advanced search on NHS evidence that allows you to search different databases simultaneously. We've made it much easier for people to use this service. And this will launch at the end of the month. So if you haven't got an Athens authentication yet, I would urge you to get one and see for yourself how this service works. So that's what our teams have been extremely busy doing for the last 12 months, and thank you to all of them for that. I hope it has given you a sense of the level of work that's going on behind the scene to make sure that these products are getting to our audiences and are meeting the expectations of our audiences in a changing world. Now, what we there's really no letting up on this work for us. We know that 30% of NHS staff from our own research are using their smartphone at work, and that's growing very fast. We've heard recently from the GMC that 30% of doctors are using a medical app at work, and the GMC is expecting that this will rise to more than 80% by the end of the year. So it's quite exponential at this point. So we are at a breakthrough time, probably in health and social care. So what we're doing, we're busy continuing with making more of what you've seen today. But there are also another 3 areas I'd like to talk to you about that we're working on. We're trying to improve our compatibility across devices, bearing in mind we can't possibly cover all devices there, but we know that particular devices are taking off faster than others, particularly tablets, and so we are working towards ensuring that our key products will be available through this device. Another important development is what I've called here the simple single sign-on. This is about making it easier for our users to use the NICE services, and particularly some of the legacy services that have come from organizations that have joined NICE over time over the last few years. You don't want to have to use multiple different passwords to go through the different services of NICE. So we'd like for everyone to have one password that gets them through what they need from us. And finally, we want to do more to help our audiences, yourself there, manage the vast amount of information that's hitting them on a daily basis. And so in order to do that, we need to sort of personalize our interface with our audiences much more. And one of the areas we're exploring is developing a more personalized evidence notification service that would tell people about what they've told us they're interested to hear about. So these are areas we're working on, we're continuing to work on this year and the next. So I've almost finished with my presentation. What I wanted to leave you with now is a preview of the next product of the digital sort of production line of NICE, and that's the BNF NICE app. So I have a short movie again playing behind me. You will have seen this one in the main hall. But this effectively is about, again, making it much more accessible for users, making up-to-date prescribing information available to users wherever they are. Once you have downloaded the app, you will not need Wi-Fi to access the information. It will be available again at your fingertip. And so the aim is to make this information available to the NHS and also to keep the NHS up to date. So over time, we'll be moving to a monthly update, which means that there will not be a need to wait for the BNF to be published on a 6 monthly basis to access up-to-date information. It will be possible to have up-to-date information on a monthly basis on your phone at any point in time. So that's the end of my presentation. Thank you very much for your time, for attention, and again, thank you for the team for the work they've been doing to make this happen.